On Thursday, October 18th, dozens of physicians, medical students, nurses, and AIDS activists protested outside the exclusive Ritz-Carlton Hotel, where both major presidential candidates appeared together at a charity event. Michael Tequili called for both Obama and Romney to support the so-called Robin Hood tax.
If we put a small, tiny tax on the speculative trading that Wall Street does all the time, every day, we would be able to generate billions of dollars. And that money can go to ending the AIDS crisis. It can go to fixing our failing healthcare system. It can create a lot of jobs and also take care of climate problems.
Also taking part were activists with Physicians for a National Health Program and medical students like Lucia Lang.
I think it's absolutely ridiculous that we are the only developed country in the world that spends so much on healthcare but does not have a universal healthcare system, that we have 49 million people uninsured right now, and if we get rid of Medicare, there will be an additional 49 million people uninsured, and I just think that's ridiculous and unacceptable.
Matt Anderson said the country's healthcare system is marked with inequality.
By almost every measure, the Bronx is the sickest county in New York State, and it's also the county with the least number of primary care doctors, which means that folks like me are extremely busy trying to meet the need for primary care.
Pediatrician Steve Auerbach says America needs something neither Obama or Romney support, a system that provides universal coverage.
What we need to do with regard to health care is what's called single payer, sometimes Medicare for all. I like to refer to it as the all-American health insurance plan. Everybody in, nobody out. Economists have analyzed it, perfectly mainstream economists. The Lewin Group, which is actually owned by a for-profit health insurance company.
Many advocates like Auerbach are also critical of how the media has portrayed the differences between Obama and Romney's healthcare policies. Critics have noted, for example, during the coverage of the presidential campaign, many mainstream journalists have worked under the assumption that both Social Security and Medicare are going bankrupt.
Well, that's what they say. It's the same folks who have been wrong about everything up till now. It's the same folks who said deregulate Wall Street. It's the same folks who said lower the taxes on the rich are now saying that. And it's simply not true. So first of all, we need to separate a few things. Social Security is not going bankrupt, period. Medicare is having increasing expenses because it's only the elderly and the sick. The healthy and the wealthy go into the for-profit private insurance pools.
While both the Romney and Obama campaigns have recently run ads attacking the others for planning on cutting these entitlements, Auerbach says in reality, the cuts are likely no matter who wins the election.
After the election, regardless of the outcome, the so-called fiscal cliff, which is completely ginned up, is going to be used as an excuse by Republicans and Democrats to cut a compromise that's going to result in potentially cutting Social Security, cutting Medicare, cutting Medicaid, voucherizing and privatizing. It's a mistake. It's the wrong way to go.
Many at the protest said they support Obama in order to prevent a Romney victory. But another medical doctor who was not present at the protest but is also harshly critical of the healthcare policies Obama and Romney support is Green Party presidential candidate Dr. Jill Stein. Stein, who was arrested and detained for 8 hours for attempting to participate in the last presidential debate that took place in Hofstra University, says the core problems with healthcare will not be addressed unless a third-party candidate is elected.
Absolutely. And there's no excuse for cutting Medicare and Social Security. These are programs that are essential. Social Security keeps 20 million elders out of poverty, and to start whittling away at Social Security cost of living adjustments, which is what Obama has been talking about, or to be raising the eligibility age for Medicare would be devastating. To raise the eligibility age for Medicare would leave people really uncovered in their retirement years, in their 60s for much of that decade. So this is absolutely unacceptable. It's also completely unnecessary and reflects the priorities of both Obama and Romney, and that priority is to serve their corporate sponsors in the pharmaceutical and insurance companies.
Advocates say they will continue to demand that all the presidential candidates support a single-payer universal healthcare system. Reporting for The Real News, this is Jessel Noor in New York.